And now I want to tell you the key to writing an amazing patho. And that is, hello humans, welcome back to my channel. And if you're new here, welcome. My name is Kata and I make videos about my nursing journey as an immigrant student. When talking to nursing students, one of the things that seems to be a huge challenge is how to write a good pathophysiology paper. When I myself started writing patho papers, I had no idea what I was doing. But through the years, slowly, carefully, meticulously, calculatedly, I found a formula that without a doubt, fail-proof, will help you get the A you want. So if you want to learn how to get an A on every single pathophysiology paper you submit, keep watching this video. And please consider subscribing and hitting that bell so that you don't miss any new videos that I post. So step number 1, open up that Word document and write down everything that you already know about the system in question. What do I mean by that? If your patho is going to be on, say, heart failure, the first thing you want to do is write down everything that you already know about how the heart works. And you're going to do this going from the most broad things to the most narrow. So for example, if I were writing about the heart, I would start talking about the anatomy of the heart. It rests in the mediastinum, it has 4 chambers, the blood flows like this, it has 4 valves, blah 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 blah. Conduction of electric impulses, systole and diastole. Anything that you can come up with that you can remember at the top of your head about the system in question, write it down. Why is this important? If you start your patho paper with just looking it up and writing it down, you're going to be doing this automated process that you don't quite understand and you're not quite a part of it. If you start your patho project by pulling information out of your own head and writing it down, you're going to start with a much more familiar understanding of the system that we're talking about. Once you have jotted down everything that you can possibly think of about the system from broad to narrow, you are going to make sure that you're bringing this to the cellular level. What do I mean by that? If the system you're talking about is the kidneys, make sure that you bring it down to the nephrons, the glomerulus, the parts of the nephron, and what kind of molecules are being exchanged through which kinds of tissues. If you're talking about the respiratory system, make sure you mention the alveoli and the blood and the epithelial tissue and the gas exchange. If you're talking about a neurological disease, make sure you mention the neurons, connections between them, maybe even fluid and electrolyte exchange. So once you've written all down, step 2 is to make sure you have jotted down the cellular level, or even molecular, depending on what your teachers want. Step 3 is to fill in the gaps. This is when you're actually going to go in and look this system up on your textbook, on your website that you're going to look it up in, and basically make sure that you have everything. Literally fill in the gaps. After you do this, you can reorganize the paragraph and structure it so that it's from broad to narrow and making sure that you have the cellular level. Once you have finished this, we can move on to step 4, signs, symptoms, and complications. My suggestion for you is that you start with HALLMARK signs. For example, if you're writing your paper on acute respiratory distress syndrome, one of the hallmark signs of this is refractory hypoxemia. So you're going to put down the hallmark signs first and explain what they are. Then you can just proceed to look at your book or the website. I'm just going to keep saying your textbook. You're going to look at your textbook and you're going to actually copy the list of signs, symptoms, and complications that are in your book onto your paper. It's very simple. Just copy and paste the list. But don't stop there, because now we move on to step number 5. Connect them to the patho. It is not enough to just write down your signs and symptoms and complications and move on to the next part. You have to be able to justify why the item has been listed as a sign, symptom, or complication. This is when it is extremely helpful that you pull stuff out of your brain rather than just copying and pasting on the first stage of this paper. Now is when you need to use your brain the most. So for example, in here, this paper is about acute respiratory distress syndrome, or ARDS. And one of the signs and symptoms is dyspnea. So instead of just writing patient experiences dyspnea, I wrote expected findings include dyspnea from lungs' impaired ability to expand and the lack of appropriate gas exchange. If you're talking about acute kidney injury and you say one of the signs is oliguria, you need to be able to explain why the patient is not peeing enough. And you're gonna go back to the nephrons and how they're damaged and how they're not being able to concentrate urine. make sure you're connecting them. I cannot overemphasize this. Same with complications. On this arts paper, I wrote that renal failure is one of the potential complications. Why? From decreased renal perfusion. Or barotrauma. Why? From a ruptured or over-distended alveoli. Always bring it back to the disease process. Step number 6 is medications. For every single medication that you write down, and you can copy and paste them from your textbook as well, but for every single medication, you need to think of 3 things: why they are given, what to watch out for, and a potential antidote. So for example, for ARDS, I wrote that these patients may need benzodiazepines like lorazepam or midazolam. So I said the class, 2 examples of the class. Then I say the reason why it's given: to reduce anxiety and resistance to ventilation. These medications also decrease oxygen demand. And then in parentheses, I wrote, watch out for oversedation using Richmond Agitation Sedation Scale, and monitor for respiratory depression. So far I said the class, 2 examples, why it's given, what to watch out for, and the last thing would be the antidote, flumazenil. I also wrote down that opioid analgesics like morphine and fentanyl are used for pain management, and respiratory depression is a common complication. Respiratory rate should be monitored constantly, and naloxone is the antidote. For every single medication, why it's given, what to watch out for, potential antidote. Not all of the medications have antidotes, okay? But if they have it, it must be there. Step number 7 is nursing interventions. You want to think of at least 3 priority nursing interventions. Hopefully they are evidence-based practice, and you're going to relate them to the original problem. This is when you're going to use your ABCs, your nursing process, and you're going to decide on at least 3 and put them in that order and explain why you're doing which first. Every school is different, so your school may ask for things that mine didn't, and mine may ask for things that yours didn't. But the absolute key to writing the perfect pathophysiology paper, if you didn't catch it from my constant repetition throughout this video, is to connect everything back to the disease process. Your pathophysiology paper cannot have a single isolated fact. You cannot add anything to your paper unless you can justify how it relates to the pathophysiology, the specific problem in question. So to sum it all up, jot down everything that you already know. Bring it down to cellular level. Fill in the gaps. Write down your hallmark, signs, and symptoms. Connect signs, symptoms, and complications to the patho. Write down your medications, including why they're given, what to watch out for, and potential antidotes. And think of at least 3 nursing interventions in priority order. If you follow these simple 7 steps, it will ensure your ability to write an amazing patho. If you found this video helpful, give it a thumbs up and don't forget to subscribe if you don't want to miss any of my new videos. You may now go and begin writing the best patho you've ever written. Best of luck!